speaking about oxidative stress. As I mentioned, the oxygen. Now, oxygen at that certain condition, at level, it's bad. If you go over limits, and now the idea is how to manage the oxidative stress and how to cure diseases or prevent diseases using a proper management of oxidative stress. And Professor Inufusa also, it is a CEO of TIMA Japan, and they have produced the strongest antioxidant in the world. It's a combination of various natural products. And also another product that if you get drunk tonight in the Cretan show, he has a product to decrease your level of alcohol in the blood by 50%. So, Professor Inufusa.
Good morning, ladies and gentlemen. I appreciate that Dr. Florian Congoli to have such a nice presentations opportunity. Okay. So this is a photo from the last year, Panama, 2023. And then we saw the amazing dancer. And he said, prevention disease is very important. Okay. I would like to, appreciate as well that Professor Ferid Murad, unfortunately, he passed away, but he is, he researched nitroglycerin vasodilator research. And then he found that nitric oxide, NOx, is important effect in that blood vessel of the heart enlargement. And then nobody found, since that dynamite was developed over 100 years. And then nitroglycerin was used for that anti-angina medicine. And then he found that gas communication is making that nitric oxide NOx is very important to that system. And then his finding, and or maybe that Viagra was born. Okay. Oxidative stress, maybe that name, but does not understanding well but the functions. If you cut that apple and stay on that air, you see that turn on the brown, color turn on. This is oxidization. And the same things will be happen in our body. So here is ROS is reactive oxygen species that cause a huge problem in our body, like inflammations and then cancers, arteriosclerosis, hypertension, tissue injury. It's lots of bad effects in our body. However, our body is protected by oxidative stress. For example, if that in your body, bacteria or virus was founded, a white blood cell, neutrophil, will found and the phagocyte eat, but they cannot destroy by themselves. What they're using enzyme and then the hypochlorous acid and the hydrogen peroxide. As you know, the hydrogen peroxide is used for that detergent for that bleaching that crosses. And then you can easily understanding if you touch that, Clorox or bleaching agent, your finger turn to white and starting the inflammations. So high level of hydrogen peroxide in your body makes inflammation all your bodies. So this is a dangerous things. So these hypochlorous acid and the hydrogen peroxide is the final product of oxidative stress. So problem of the pharmaceutical product is used after only after the diagnosis, not for the preventions. And then only single material, single protein, single enzyme, single chemicals is only authorized as pharmaceutical. So that meaning is multiple composition is not authorized as pharmaceuticals. I invented that the Twendee X. It's a very simple thing. As you see, the L-glutamine, vitamin C, cysteine, coenzyme Q10, succinic acid, and fumaric acid, and riboflavin, and niacin. And then I have lots of patent of this product because it has a very strong antioxidant effect without side effect. So this is data of the broad level of the hydrogen peroxide in humans. As you see, the parameter shows going down like 30% within 3-4 weeks. This is a dramatic decrease because that many scientists using that some amino branch product or something like that, but it is reduced only 5 to 10% after the 6 months administration. And then this is a scheme of that how dementia, Alzheimer development, hypertension, diabetes, acute stroke, increasing that oxidative stress in your body, that cause inflammations, and then amyloid beta production starts. And once amyloid beta produced, additional oxidative stress going down. So this is really, bad cycles. And then this is data from Professor Abe. This is a mice model for that Alzheimer. And then what he found is Twendee X reducing that amyloid beta and decrease that oxidative stress and then also inflammations. So, and then finally, we did human clinical research, and this was published in the 2019, and the clinical benefit of antioxidant supplement Twendee X of mild cognitive impairment. Multicenter randomized double-blind and placebo-controlled prospective studies. And then data shows this research was did on that mild cognitive impairment patient. And then you see that the MMSE score was significantly increased, and then the Hasegawa score also increasing. And then I would like to shortly tell you that other data. This is a data from the atopic dermatitis. And then the dry skin is a big problem of that atopic dermatitis. And then you see the 4 weeks after, the dry skin is really decreased. Another allergic disease is asthma. Asthma attack was induced by oxidative stress. If you have a high oxidative stress, many people call that asthma attacks. You see that the red part or pink part is heavy attack numbers. It's going to be really decreased like half in the 4 months after. And then this scheme shows COVID infection induces that reactive oxygen species, ROS. And then actually, COVID infection cause huge problems for your bodies. Okay. And then actually, virus itself is not have such effect. What is the reason why is reactive oxygen species, oxidative stress induced by that virus attacks at the lung, blood vessel, and immune systems. So huge oxidative stress damage your immune systems. So we did that Twendee X administration for that vaccine side effect. And then here is a parameters: fatigue, breathing difficulty, chest pain, smell and taste disorder, headache, brain fog, joint pain, and then the dizziness. All parameter is going down to that half. And then what we did is long COVID. I think still many people suffer for that long COVID. Same experiment. And then we saw that the all 8 parameter is going down. And then by the publications, there is no such study in the long COVID or vaccine side effect till now. So, and then I developed that additional composition called Twendee M, TWM. And then the ingredient, what I added is the pantothenic acid, the thiamine, vitamin B6, folate, biotin, vitamin, it's 12, and lactoferrins. And then I succeeded to increase that antioxidative, effect, 150%. And then only I added that these additional 7s is less than 7%. Many people is misunderstanding. If you take that antioxidant as many as possible, that increase that oxidative stress. So that like a vitamin C, vitamin E, there is appropriate dosage for that human, they exist. But, supplement seller or maker says, oh, you have to take as many as possible. That's wrong. This is a problem that the antioxidant cause future problem, cancer advancing or immune system damaging. So that the appropriate dosage is very important. So this is also a Twendee TMT on the chronic fatigue syndrome. Actually, there is no effective medicine or supplement for that chronic fatigue syndrome. But as you see, there is a lots of point as decreased 1 month after that Twendee control. And then this is a sleep disorders of the chronic fatigue syndrome. You see that many people free from that suffering. And then I would like to mention about that broad perfusion things, and then broad reperfusions. If you have a brain ischemia, ischemia or heart attacks, doctor do that reperfusion to help that life. But the problem is, once reperfusion started, damaged organ release more and more oxidative stress. In the case of that brain ischemia in Japan, we have using that edaravone. This is a kind of phenol, so one-time injection after the stroke, but it is really have a huge side effect. So only one time. But in the case of that heart attack, heart ischemia, 20% people and dies immediately after the attack. And then other 30% people die within heart failure, like 7 days, around 7 days after attacks, because reperfusion of that muscle, heart muscle, is produce lots of reactive oxygen species. And then that make inflammation in the whole of the heart. That causes the heart failure. But no treatment exists before. So this is the data from Professor Abe. This is a mice brain ischemia models. And as you see, that Twendee X administration reducing that volume of that damaging area in the brains. And then also that oxidative stress going down and the inflammations going down. And then this is a case of the heart what's going to be happening after the reperfusion ischemia attacks. Okay, so ROS from necrotic muscle, the reperfusions increase ROS, and the inflammation, the heart failure. I have a very good friend of world famous guitarist, Mr. Albert Di Meola. He's very famous for that Return to the Forever, and then and the top of the world scientist. And he had a heart attack last year, September, and then he got treatment in Bucharest, Romania, and then 5 days after he discharged. What's going to be happening? Actually, he has taken the Twendee control since 2020. And then after the heart attack, I contacted him and increased that taking time twice, morning and afternoon. And then he had enough reduction of the reactive oxygen species. So, and then he had no heart failure and discharged 5 days after. He was very, very happy. But he was very lucky because his usual hospital does not allow to take any supplement during the hospital stay. But Bucharest doctor was very open-minded. They said antioxidant. Oh, please go ahead and use it. And he's very lucky. And then this is conclusions. Antioxidant therapy effective in various diseases. Many diseases have no treatment or preventions. Heart attack and brain stroke are our target now. And then we have evidence that in brain stroke, and then we estimate the heart attack survival improves. So we think antioxidant therapy is beyond our limit. Thank you very much.
Thank you, Professor Inufusa. As always, a pleasure. You have please. So you see, you can have individual components like vitamin C or any other natural components, and still, when you have a combination of those, the effect is much more powerful. Like the principle of thermodynamics, if you have a little bit of everything, the effect might be much more powerful. That's the case here. The entire invention, it is on the ratios of particular well-known components. The ratios make a difference, and this is the powerful, the powerful and the most powerful oxidant in the world. And we have a symposium specifically after lunch, specifically dedicated to antioxidant symposium, dedicated to Professor Abe. He is the director of a hospital in Japan, this is our 5th or 6th symposium in a row, and this is an exploding field. This product that Professor Inufusa mentioned, Twendee X, I've been taking it every day just for prevention. I can tell you, I rarely get sick. If I get sick, it passes within 1 or 2 days. So thank you very much again. We appreciate it. But he has another one that he doesn't mention, but it's so powerful also. It's called Supaliv. It's the same components but different ratios. And then it decreases the if you drink so much alcohol, and we'll give you for free during the evening tonight. So if you drink too much alcohol, that decreases the level of alcohol in the blood by 50%. But sure, you should not overdo it, because if you take 3 tons of alcohol, still you will be 1.5 tons in your blood. But this is just to help avoid especially the. Thank you very much. Thank you very much.